Thank you so much for attending the Boost Your Budget workshop. This is a workshop to inform you about low-income programs for Medicare beneficiaries and also for really anyone on a fixed or limited income. We're going to go specifically over some things that only impact people on Medicare, but there are also a host of other resources that we're going to talk about in this workshop that you don't have to have Medicare in order to access. There we go. So we're gonna really try to help you identify and connect with the important programs SHIP and SMP. I'm in the SHIP program. The Aging and Disability Resource Center, which is the call center for the Aging and Long-Term Services Department. We're going to review Medicare and Medicaid very briefly. We're going to talk about Medicare savings programs, which is probably the most important resource for people on Medicare to help keep those insurance costs under control. And the extra help or low income subsidy, which goes hand in hand with the Medicare savings programs. And then other programs to help with rent, utilities, food, and all of those social indicators of health. So my program is the New Mexico State Health Insurance Assistance Program, or SHIP. I think of it as a boat that helps you navigate the sometimes choppy waters of Medicare, Medicaid, and other benefit programs. It's a federal and state partnership program. I get ongoing training from the Centers for Medicare and Medicaid. In fact, the national SHIP conference is going on right now, and I'm skipping out of part of it to be here with you today. We offer free and unbiased information and assistance to people on Medicare, family members, caregivers. So we do that one-on-one counseling with people. We also do a lot of education and outreach. Basically, if you have a question about Medicare or any issue with your Medicare coverage, we should be your first call. And you can reach us by calling 800-432-2080. This is the New Mexico Aging and Long-Term Services website. It's recently been updated, and you can see it's extremely user-friendly, easy to use. If you need assistance with anything related to COVID-19, the Medicaid waiver for in-home caregiving services, transportation services, housing services, it's all right there. All you got to do is click and you'll see those resources and be on your way to getting some assistance. The website is up above and down below because I want to make sure you don't miss it. You can also access all these resources by calling that 800 number, 800-432-2080. Our sister program is called Senior Medicare Patrol. It's such an important thing for seniors who are, as we know, the target of so many scams and fraudsters. The Senior Medicare Patrol is the organization in our state that is really dedicated to healthcare fraud prevention. And they're there to help people avoid, detect, and prevent healthcare fraud. If you feel like you may have gotten one of those iffy calls, maybe you gave out some information you're not sure you should have, they're the people to contact, because not only will they help you learn how to avoid, detect, and prevent the healthcare fraud, but if something did happen that you're not too sure about, they can also investigate. And that same phone number, you're going to hear it from me about 1 million times today, 800-432-2080. It's one number that gets you access to all of these resources. And that number goes directly to the Aging and Disability Resource Center, or ADRC. That is, as I mentioned before, the call center for the Aging and Long-Term Services Department for the entire state of New Mexico. When you call the ADRC at 800-432-2080, you'll be speaking with an options counselor and they will be able to contact you with resources for federal, state, and local assistance with housing, utilities, food, medical costs, and more. They use something called the Network of Care, which has just thousands of resources that encompass the entire state of New Mexico. It's also the place to start if you are in need or someone in your family is in need of in-home caregiving services. Medicare doesn't cover in-home personal care services except under very limited circumstances. And so if you're in need of those services, the best way to go is the Medicaid program called the Home and Community-Based Waiver. And the starting place for that benefit is through the ADRC. You cannot apply for it directly from Medicaid. You have to start at the ADRC. And you start by calling 800-432-2080, and the options counselor will take you through an assessment over the telephone, and then your application will progress from there. You can also get access to short-term assistance by calling the ADRC. That is if you're having some sort of issue with your Medicare, Medicaid, or accessing benefits. You'll get a referral to someone from the SHIP program, my program, and we'll follow through with you through the benefits process until you have a final answer. You've either been approved or denied for the benefit that you're trying to access. We also do a lot of counseling for people who are new to Medicare in the SHIP program. The short-term assistance, we can assist with applications if people don't have access to the internet or need assistance with applications due to a disability or any other reason. The SHIP program is who you'll be referred to for that kind of help. And then we already mentioned the Senior Medicare Patrol. If you're having issues with scams or fraud, or maybe there's some billing that you're not quite sure about that you need to get to the bottom of, the Senior Medicare Patrol is who you'll be referred to after you've called the ADRC. There's also a prescription drug assistance program, which is so important for people. Oftentimes, even if you have insurance, the co-pays on some of the medications just put them out of reach. And so we really don't want anyone rationing their medication or not taking it as prescribed because they can't afford the copay. If you find yourself in that situation, please do call 800-432-2080, and you'll get a referral to the Prescription Drug Assistance Program, and they will work to connect you with programs to help you get your drugs for a reasonable copay, or sometimes no copay at all. So in order to get to some of these resources, this again is the New Mexico Aging and Long-Term Services Department's website. On that first page, which started with those buttons we discussed before about housing resources and the waiver, if you scroll down just a little bit, you'll see these buttons that will connect you with these other programs, and right underneath it, the Network of Care that I mentioned before. It is publicly accessible. All you have to do is type in the keywords of what you're looking for: transportation, housing, and your zip code, and the Network of Care will help you begin to access resources in your area. So what is Medicare? Medicare is health insurance for people 65 and older. It's really the main health insurance resource for people who are 65 or older. Also for people under 65 with certain disabilities. Once you've been on SSDI or disability for 2 years, no matter your age, you're going to be switched over from Medicaid to Medicare. So it's not just for people who are older. Sometimes it is also for people with younger people with disabilities. So in order to be eligible for Medicare, you must be either a U.S. citizen or somebody who has been here legally in the U.S. for 5 continuous years. If you want to know more about Medicare, how it works, maybe you're getting ready to turn 65, or you've been on Medicare already, but you're not quite sure how it all works, you have your fingers crossed that it's going to continue working for you. I want to let you know that we do offer a free virtual Medicare 101 workshop every month on the first Wednesday of the month from 9:30 to 11, kind of like this workshop that we're doing right now. It'll be offered via Zoom. And to access that, you can go to the Aging and Long-Term Services website down there at www.nmaging.state.nm.us. And there will be a link to the virtual workshops there. You can also call the Aging and Disability Resource Center at 800-432-2080, and they can let you know how to connect with that. So in the next main benefit that you probably are going to need for your insurance is Medicaid. And a lot of times people get Medicare and Medicaid confused because they sound so similar. Unlike Medicare, or like Medicare, Medicaid is also a federal and state program, but it is administered by the state, whereas Medicare is mainly administered by the federal government. It is medical assistance for people with limited income and resources. It covers about 74 million adults and children. Both, the adult program is Medicaid. Children, the acronym is SHIP, S-C-H-I-P. It supplements Medicare for more than 10 million people who are elderly and disabled. So these two programs are really designed if you are elderly or disabled, they're designed to work together, and I'm going to help you learn about how those connect and how Medicaid can help keep your Medicare more affordable for you. So what the heck is the difference between Medicare and Medicaid? So Medicare is a national program. It is consistent across the country. It works the same way no matter what state you're in. Medicaid is a state program, and there's a lot of variation from state to state, particularly in eligibility and what benefits are offered. Depends on the state's resources. Medicare is administered by the federal government. Medicaid is administered by state government within federal guidelines. In order to continue, for most states, our state included, Medicaid has federal matching dollars, and in order to get those matching dollars that we rely on to make sure that our low-income people have access to high-quality health care, we do need to follow those federal rules. Medicare is health insurance for people 65 and older, and people under 65 who've been on disability for 2 years, or anyone with end-stage renal disease. And Medicaid is health insurance for people based on need, financial, and non-financial requirements. There are some programs that have medical eligibility requirements as well. Medicare is the nation's primary payer of inpatient hospital services for the disabled, elderly, and people with end-stage renal disease. And Medicaid is the nation's primary public payer of acute health care, people who have, health issues come up suddenly, mental health and long-term care services. They are quite different in what they cover. For example, if you've been on Medicaid and you have a disability and then you switch over to Medicare, you're probably going to take a minute to figure out how Medicare works, how to get the resources and benefits that you had under Medicaid. And in that case, if you find yourself in that situation, I highly recommend you call and ask for assistance from the SHIP program, my program, at 800-432-2080. So the main benefit that people who have Medicare have access to help reduce their insurance costs are Medicare savings programs, or MSPs. They're Medicaid administered programs. They help cover Medicare premiums, which are $148.50 a month, and also cost sharing for people with Medicare who have limited income and resources and don't qualify for full Medicaid. There are very, very limited circumstances under which you may qualify for a full Medicaid program once you're eligible for Medicare. Generally speaking, the MSPs are the main benefit program for people who have Medicare to help reduce those costs. So here in New Mexico, in January, the eligibility requirements changed for MSPs. So you'll be assessed for the program based only on your income, not on your resources. So I've talked to many people who've applied for this benefit in the past and been denied because they had too much money in the bank or other resources. And it's super, super important to know that if that is your circumstance that's happened to you, you may very well now be eligible for this benefit that would pay your Medicare Part B premium for you, put an extra $150 a month into your check. So it is very much worth your time and effort to apply for the Medicare Savings Program again, even if you've been denied in the past because of this change. The only thing that will be considered in your application is your income. So since Medicare is a primary health insurance for seniors 65 and older and many younger adults who receive SSDI, this benefit is the main one that helps make that more affordable for you. Since Medicare isn't free, there is that $148.50 a month premium for Medicare Part B. Out-of-pocket costs, including premiums, deductibles, and co-payments or co-insurances, can really add up. This is the program that helps with those costs. They make Medicare affordable for those low-income people who qualify. It is a quick and easy application, and I'll show you in a minute what that looks like. I help people with it over the phone all the time. Basically, there are 3 types of Medicare Savings Programs coverage. The highest level of benefit is called QMB, Qualified Medicare Beneficiary. It pays your Part A premium if you're not eligible for free Part A, and it also pays the Part B premium, which is that $148.50 a month that we talked about earlier. And it also pays your deductibles, co-pays, and co-insurances. So basically, if you qualify for QMB, you're not going to have any out-of-pocket costs at all for your Medicare. The next 2 levels of benefit, Slim B, Specified Low Income Beneficiary, and QI1, or Qualified Individual, they pay just your Part B premium. The Part B premium is generally deducted out of your Social Security check before you even see it. So what you'll notice if you qualify for one of these benefits, Slim B or QI1, is that you get $148.50 a month more than you're used to in your check. These 2 levels of benefit do not pay your deductible copayment or co-insurance, but an extra $150 a month still goes a long way towards making your health insurance more affordable. If you need help applying for these benefits, you can call 800-432-2080. And we will be more than happy to help you with that. There's another benefit, Medicaid benefit, called Qualified Working Disabled Individual, or QDWI. It's very different from the other 3 Medicare savings programs because it's designed for people under age 65 who lose their premium-free Part A because they've gone back to work after getting SSDI long enough to have received Medicare. You know, we don't want for people to feel like they can't go back to work if they want to because they would lose benefits. And so that's where this program comes in to try to help people. It's a benefit that helps people keep their benefits if they want to return to work and they're disabled. So for all of these programs, if you qualify for the Medicare savings programs, you're not going to have a Part B late enrollment penalty. If for some reason you didn't take Part B when you were first eligible, and maybe you've avoided it because you know that there are going to be penalties, if you qualify for one of these programs, you can get Part B and not have to pay a penalty. So it's a very, very important thing to know so that you can get the health insurance that you need. There's also no estate recovery. Sometimes I talk to people who don't want to apply for a Medicaid program because they're worried that they'll have to repay it. And there is no repayment for these programs. And in addition to the benefit that you get, help paying your premiums and possibly your copays or coinsurances, if you're eligible for a Medicare savings program, you're also automatically going to get the Part D low-income subsidy or extra help. This is a Social Security program that helps pay for prescription drug premiums and copays. It's a very important benefit because as we mentioned before, sometimes even with insurance, those copays on your drugs can really make life difficult. This program is there to help. You don't have to have a Medicare savings program to get extra help or the low income subsidy. You can also apply for it separately. So if you apply for one of the Medicare savings programs and are not eligible, you may very well still be eligible to get extra help, and we can complete a separate application for that if necessary. Okay, how do you know whether you're going to qualify for one of these Medicare savings programs? The highest income limit, is for the QI-1 program, and that is $1,469 a month for a single person or $1,980 a month for a couple. So if your income is at that level or lower, less than that, you will very likely qualify for one of these programs, and you absolutely should apply. And you can see that SLIM-B, the specified low-income Medicare beneficiary, has a slightly lower income limit, $1,308 a month for a single person, $1,762 for married. And for the QMB, which is the benefit that covers not just your premium, but also your copay or coinsurance or amounts, the income limit is $1,094 a month for a single person and $1,492 a month for a couple. So you don't apply, when you apply for an MSP, you don't apply for a specific benefit. You just put in your application and they screen you into the correct program based on your income. So if you think you might apply for one of these MSPs, you can, I just gave you the local guidelines. You can contact the Medicaid to apply, or you can contact us, the SHIP program, at 800-432-2080, and we can help you apply as well. I highly recommend doing the application online, and I'm going to show you what that looks like in just a sec. It's much faster than processing a paper application. And if you call our office and ask for assistance applying online, because either you're not comfortable doing that with a computer, or maybe you don't have access to a computer or the internet, we can get that application done for you online. And it takes about 15 minutes to get through the whole application. You're going to need your Medicare ID. That's the red, white, and blue Medicare card that has your actual Medicare number on it. If you're in a Medicare Advantage plan, you may have a different card from your insurance company. That's not the one we need. We need the actual red, white, and blue Medicare card that has your ID on it. Information about how much you have in the bank and your Social Security number. You can complete the application at your local Income Support Division office. Our office can mail you a paper application if that's the way you like to do things. You can go online at yes.state.nm.us and apply directly yourself through the Income Support Division website. And you can also call us at 800-432-2080. And we can either mail out a paper application for you, or you'll get a referral for someone from the SHIP program to call you and complete an online application. And this is what the website looks like. It is the state Medicaid website. If you were going to do an online application, you're going to need to create an account. And then complete the application process. And as I said before, it is quick and easy. It only takes about 10 or 15 minutes. So I mentioned earlier Extra Help. Extra Help is a Social Security program that helps people pay for their prescription drug costs. It's also called the Low Income Subsidy, or LIS. And, you know, we like to call things by multiple names. Gives me job security, because then you're not quite sure what we're talking about and you have to call me and I'll explain it. So this is for people with limited income and resources. It pays at the lowest income and resource level. If you qualify for Extra Help, it will pay your Medicare Part D drug plan premium and any deductibles, and leave you with small or no co-payments. There are different levels of the benefit. So if you have slightly higher income and resources, you may qualify for the level of benefit that helps you pay a reduced deductible and lower co-pays. If you have this program and you've reached the catastrophic coverage limit, which means you've spent over $5,000 out of pocket on your drugs, then you'll generally pay nothing for the covered medications for the rest of the year. If you need, I'm going to show you in a minute where to apply for this benefit. You apply for it. You can either get an application from us in the mail, or you can apply for it online at ssa.gov. Okay, so if you get full Medicaid coverage or a Medicare Savings Program, you're going to automatically get Extra Help, and you don't need to do a separate application. Also, if you get SSI benefits, you will automatically get Extra Help, and you do not need to do a separate application. If you do need to do an application because maybe your income is a little bit higher than what's allowable for the Medicare Savings Programs, then you can apply online at ssa.gov. And the website is right here. You can also call Social Security at 800-772-1213. And, whoops, sorry. And you can apply both SHIP our program through the Aging and Long-Term Services Department. That 800-432-2080 number will assist you with an application, and so will Medicaid. So the resource limits for Extra Help, the income and resource limits, and this is a year. So for the Medicare Savings Program, I gave you the income limits monthly. For this program, it's yearly. So if you make $22,230 a year or less, or if you're married and make $30,060 a year or less, that's the income limit for the Extra Help program. And you can, this program does have resource limits. If you have $13,290 or less in resources, or $26,000 or less as a couple. So here is the SSA.gov page where you would go to apply online for either Medicare, if you don't already have it, or for the Extra Help program. You just scroll down to the bottom of this page and you'll see it there. Okay, those are the main Medicare related benefits. I'm going to pause for a sec to see if anyone has questions about this before I move on to some more general resources that aren't related to Medicare insurance costs. Okay, so a great place to get an exhaustively complete analysis of what benefits you might be eligible for from the federal level right on down to your local level is the National Council on Aging Benefits Checkup. It is truly a very, very complete assessment of all of the programs that might be available to you. And you go on ncoa.org and you can do this benefits checkup online. This is another program that if you don't have access to a computer or you want assistance with this, you can call the ADRC and ask for help, and a SHIP counselor will be able to assist you with this benefits checkup online. I've gone through this with people. It takes quite a while. It's not a short call like applying for the Medicare Savings Program, which we can be done within 10 or 15 minutes. I would set aside an hour to get through this whole assessment. And then you may end up with pages of potential resources to call on a variety of needs, everything from health insurance costs through assistance with housing costs, utility costs. This is a very complete assessment. If you're having issues with keeping up with your rent or mortgage, this is an outstanding resource, Rent Help New Mexico. They're actually doing a drive-through assistance with ERAP. It's the acronym is ERAP, Emergency Rental Assistance Program. They're doing a drive-through help with applications on Tuesday, August 17th in Albuquerque at Expo New Mexico during the Roadrunner Food Bank distribution. And that's Tuesday, August 17th. In order to get the help there, if you've been wanting to apply for this benefit, but struggled maybe a little bit with what you're supposed to do, this is a great way to get some help with it. You'll need to bring your proof of rental agreement, proof of income for all adults in the household, and a copy of an eviction notice, shut-off notice, or notice of late payment. This benefit can help pay rent, electric, gas, and utility bills, water and sewer, trash removal bills, other housing expenses, including a hotel or motel cost if you did lose your housing and are struggling to get rehoused. So if you're in the situation where you're having trouble with your housing costs, utility costs, or other costs associated with housing, I would highly recommend that you check out the renthelpnewmexico.org. There's an online application, and as I mentioned, there's that drive-through event at Expo New Mexico in Albuquerque during the Roadrunner Food Bank distribution on August 17th from 8 to noon. Okay, another program that helps with these kinds of bills, particularly utility bills, is Help New Mexico. It's a great program. I worked with somebody not too long ago who she had COVID last year. And as we all know, boy, when you're on a fixed income, it doesn't take too many unexpected expenses to put you behind. And it can be really hard to figure out how you're ever going to catch up. So this lady called me, she'd had COVID and she got behind on her gas bill and she could not figure out how she was ever going to catch up. She didn't have a computer, so we were talking on the phone. I did the application on Help New Mexico while we were chatting. It didn't even take us 5 minutes to get through it. And a week later, she'd been awarded $150. So I highly recommend, if you're behind and you're not sure how you're going to catch up, reach out. There are millions of dollars available. And all you have to do is apply, right? Doesn't hurt anything to apply. There are also some really great resources out there through the utility companies, Gas Company of New Mexico, PNM, whatever your utility company is, it is extremely worthwhile to check out what assistance they're offering, not just for, bill forgiveness, they do have those programs, but also for weatherization and other like home energy savings programs. You can really get access to some resources that help improve your home's energy use, and that'll reduce your bills long term. So there is a weatherization program through PNM. They'll do an assessment, they'll provide you with materials. It's really, a pretty fabulous resource if you know to apply for it. Same thing with the Gas Company of New Mexico. So they have energy efficiency savings and rebates. There's a residential rebate program. They'll do a home energy analysis, and they have weatherization for low-income qualified members of the gas company. So it's definitely something worth checking out. And if you don't get your utilities from either PNM or Gas Company of New Mexico, check out your utilities website or give them a call and see what their programs are. The last specific resource I'm going to talk about here is, food assistance. Boy, food insecurity has been such a huge issue here in New Mexico during the pandemic. I mentioned earlier that the Roadrunner Food Bank is partnering with the Emergency Rental Assistance Program. So as people are picking up their food from the food bank, they can also get assistance with their rent and utility costs if they need that. This website, the New Mexico Association of Food Banks, is going to have information about food banks throughout New Mexico. So it's a great place to get started. If you're experiencing food insecurity, you just need a little assistance, you'll be able to find the resource for your area by using the New Mexico Association of Food Bank website. And of course, you can call us at 800-432-2080, and we will do our best to connect you with the food resources in your area. Well, that's a lot of information. Are there any questions at the moment? Okay, please do remember that you can find all of this information and more at the New Mexico Aging and Long-Term Services Department website, www.nmaging.state.nm.us. There is live web chat available. The web chat is particularly good for people who don't want to necessarily talk on the phone, don't have a lot of patience for being on hold if they've tried to call the 800-432-2080 number and had to wait for somebody to answer. Or if you have hearing issues and it's difficult for you to, get information over the phone, the web chat is great for in those circumstances. You'll have a live Aging and Long-Term Services Department chat agent on the other end when you're doing this. Sometimes my boss even handles the web chat, so you're really getting people who know what they're talking about on the web chat. And if your question is something that they can answer via chat, then they do that. If not, you'll get a referral from them, and somebody from the SHIP program will give you a call. You can also call the ADRC at that 800-432-2080 number for confidential one-on-one counseling about whatever issues that you're facing and you're looking for assistance with. You can also reach me. I'm not shy, give me a call. My email address is chris.winterrode@state.nm.us. I'm the Northeast Regional SHIP Coordinator. But even if you're not from the Northeast part of the state, I'm happy to talk with you and either refer you to the correct coordinator or just answer your questions or give you the connection that you need. My direct work cell phone number is 505-470-4443. I'm happy to hear from you. If you've watched this workshop or participated and you want to reach out, I'm happy to hear from you. Another great idea is to follow us on Facebook. The New Mexico Aging and Long-Term Services Department, you just type that into your little magnifying glass search window, and the New Mexico Aging and Long-Term Services Department will pop up and you can follow us and you'll get all the latest news. That's where I got the information about the Emergency Rental Assistance Program drive-through, for example. And anytime we have events coming up related to Medicare, Medicaid, or other programs in the Aging and Long-Term Services Department, you'll hear all about it on Facebook. I also put in live links to workshops, so it makes it very, very easy to attend a workshop like this. All you got to do is click on it and it will take you right into the Zoom presentation. I wanted to make sure that you know that one of the reasons that I am doing this Boost Your Benefits, Boost Your Budget workshop right now is that we have a statewide event coming up where we are going to be getting as many people as possible enrolled in the benefits that were discussed in this workshop and any other benefits that you present as needing assistance with. Will get you connected with those resources as well. You can apply for these benefits at any time. It's not just something that you can do during this Boost Your Budget benefit enrollment event, but during this time, August 24th through 26th, Our entire staff is going to be dedicated to helping as many people get enrolled as possible. If you would like some assistance getting enrolled in the Medicare Savings Program or one of the housing benefits, any benefit at all, you can call 800-432-2080 and request an appointment with a SHIP counselor for the Boost Your Budget event. And we will give you a call and we will screen you and get you enrolled in as many benefits as you need and are qualified for. That's coming up again, August 24th through 26th. So if you think you might like that assistance during that dedicated time where we've got all of our staff committed to doing nothing but helping people with their applications, please do give the ADRC a call at 800-432-2080 so that you can get your appointment scheduled. If you feel so moved to leave some feedback about this presentation, the link to a brief survey is there. It's www.surveymonkey.com/r/ACLED. And we'd love to get your feedback about whether you found this workshop useful. Okay. That was a lot of information. I hope that you found it helpful. And if you have any questions, please don't hesitate to reach out. Anytime you call the Aging and Disability Resource Center, that 800-432-2080 number, you will get a live person on the other end of the line, and they're all right here in New Mexico. This is a state agency, a state organization, and so we're all New Mexicans just like you, working to get you connected with what you need. Those, you know, you've worked hard all of your life. These benefits are here to make your golden years as golden as possible. So don't hesitate to reach out. They're here to support you during your retirement. And if you don't apply and you don't get the benefits, then they're just going to go to waste. Nobody wants that. Okay, so again, thank you so much. Please don't hesitate to call 800-432-2080 to either sign up for an appointment for the upcoming Boost Your Budget event, August 24th through 26th, or if you have any questions at all. Thank you again.